Good day and a warm welcome to each and every one of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring diverse landscapes of advanced nursing care throughout the world. My name is April Kapu. I'm the Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I'll be moderating today's session. Please let me take a moment to thank Megan Allen, who is a DNP leadership at Yale University School of Nursing, who has partnered with me in this endeavor, as well as all of my colleagues and coworkers here who have helped put this session and these series together. The purpose of this series goes beyond borders. It's a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice, education, regulation, and so much more. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. As we embark upon this journey today together, I would ask that you all keep your microphones on mute as our presenter gives their presentation. We will have time for question and answers at the end. And so now, without further ado, please let me introduce our esteemed presenter for today. Heather McGrath commenced her role as a family nurse practitioner in the primary health setting in 2010. She joined the International Council of Nurses Nurse Practitioner Advanced Practice Nurse Network in 2017, and she currently serves as the Global Membership Officer. She has co-authored Global Advanced Practice Nursing textbooks and guidelines. She reviews abstracts for many international conferences. She's a featured speaker at many international conferences. And what I really love to share, and I know my colleague Kathy Wheeler, who is on as well, is that she was one of our first American Association of Nurse Practitioners ambassadors, and she's also one of our first international fellows. So we are delighted to have Heather join. She's also on the editorial board for the Journal of American Association of Nurse Practitioners Journal, very highly read and reputable journal, not only here in the US, but throughout the world. So we're delighted to have you here, Heather. Thank you for joining. I'm going to share your slides and then I'm going to turn it over to you. And if you'll just tell me next slide whenever you would like me to advance the slide deck. So let me get your slides up here. And we should, Megan, everything good? Can you see everything good? Okay. Heather, let's turn it over to you.
Good afternoon, everyone. Good morning to some persons. I'm not so sure how many persons are joining from outside of this zone. The pleasure is mine this afternoon. Thank you so much for Vanderbilt University under the auspices of Dr. April Kapu for inviting me to somewhat share a synopsis of advanced practice role in Jamaica. Thank you for joining. Next slide. Next slide. So I'll share with you this afternoon from 3 quick objectives. I will somewhat highlight the educational preparation for nurse practitioners in Jamaica. I would like to discuss as well the scope of practice for NPs in Jamaica and to share with you the different specializations that exist here in Jamaica. Next slide. Of course, I'm from the Caribbean, so I always want to showcase my lovely island, Jamaica. So just to remind you, for those persons who are not aware of where Jamaica is located, so we are located here 90 miles south of Cuba, 60 miles south of Florida, and 100 miles southeast of Haiti. And it is the largest English-speaking Caribbean island in the Caribbean. Next slide, please. And just for you to have a picturesque view of where Jamaica is, so if you look right below Cuba, that's where we are sitting right here in the Caribbean. Next slide. And it's also 146 miles long, 55 miles wide, with an area of 4,413 square miles. The population is as small as almost 3 million persons. And we have two cities, namely Kingston on the southeast and Montego Bay, which is a tourism mecca located northwest of the island. Next slide. And here we have 13 parishes, actually 14 parishes, but Kingston and St. Andrew is merging into one. So we have 13 parishes with 3 counties of Cornwall, Middlesex, and Surrey, which are clearly seen on the slide. Next slide. Thank you. The healthcare system is divided into 3 levels, namely primary, secondary, and tertiary. So at the primary care, you'll find this is the first level of care, especially the patient's first contact with the healthcare system. And it's mostly provided at the health centers or private offices. Then we have the secondary care. At this care, you'll mostly find the hospitals where we see patients. For the tertiary care, it's a high level of specialized care within a hospital, and we only have 2 such hospitals here in Jamaica. Next slide. Of course, Jamaica is renowned for its warm climate, lovely white sand beaches, popular reggae music, delicious meals, and dominance in track and field. So in front of me, I'm showcasing one of our national dishes, ackee and saltfish. So I'm inviting persons to come to Jamaica to enjoy this sumptuous meal. Next slide, please. And of course, for all of us who have heard of Usain Bolt, of course, we own the track and field star, well, for now, in Jamaica. Next slide. So I will now take you through the historical highlights of the APN role in Jamaica. So the training, the advanced practice role actually commenced in 1977 as a result of a shortage of medical doctors, especially in the primary healthcare setting. So in July 1977, the first cohort of nurse practitioners consisting of 18 family nurse practitioner students and 7 pediatric nurse practitioner students. Next slide. The training was offered at the then Advanced Nursing Education Unit in Kingston and was introduced as a 1-year certificate program. The ANU identified the first program coordinator, Dr. Lynette Jackson-Myers, and I'm just halting here just to tell you that this doctor was actually a nurse, and she went on to further training to be a pediatrician. So she was the first coordinator for the APN role here in Jamaica. And the program was funded by Project Hope. That's a humanitarian project with somewhat look into the needs of persons in the low-income countries. Next slide. And just to give you a picture of our first NP coordinator, she died a few years ago, Dr. Lynette Jackson-Myers. Next slide. I'll take you through some basics of the education for nurse practitioners in Jamaica. So as mentioned before, so the first cohort consisted of senior nurses. So they were nurses basically who had completed their general nurse and post-basic midwifery training. And these students had to be working for at least 5 years after they were registered as a registered nurse. So at the inception, the courses included like communication, social interaction, scientific problem solving, and nursing and medical subjects. Next slide. The program consisted of an initial 6-week period. After that, students were required to complete a 2-stranded specialist component for a duration of 18 weeks, focusing on medical topics relevant to each subgroup. Then this period was followed by a 6-month internship. Subsequently, there were changes made to the curriculum, which included a modification of the pediatric component and hours devoted to research and epidemiology. Currently, the entry requirements include 5 years post-registration period, or along with an undergraduate degree or a graduate degree. All applicants are expected to attend an interview, submit a portfolio. Next slide. So I'm just giving you a picturesque view of the University School of the West Indies School of Nursing. This is the only school of nursing in the Caribbean that the program is offering at. So this is located on the compound of the University of the West Indies here in Jamaica. And The program is offered at the master's level for a duration of 2 years, as I mentioned before, the University of the West Indies School of Nursing. Students are expected to complete the following courses. So you would have to complete 3 advanced practice seminars, complete the course of Pathophysiology of Advanced Nursing Practice, Growth and Development, General and Special Pharmacology, and Research Methods Applied to Nursing. Next slide. So during the 3rd semester, so what will normally happen? So for the 1st and 2nd semester, students actually are rotated through clinical theoretical experiences. I know when I did the program, I would have shared classes like with 1st year or 2nd year medical students for pathophysiology and some components of pharmacology. So during the 3rd semester, students are exposed to the clinical aspect of the course. So like after the 3rd semester, during the summer, there's a summer program, which is mainly curtailed to clinical rotation for the students. But during that time, like once weekly, the students are expected to be in classroom where we had advanced practice seminars, and the other 4 days, they are expected to be in the clinical setting. Next slide. So I'm happy to share with you the scope of practice. So the scope of practice for NPs in Jamaica is aligned with the Advanced Practice Nurse Regulation. So it stipulates that all advanced practice nurses are required to perform their duties in accordance with the recommended standards established by the Nursing Council of Jamaica. So the Nursing Council of Jamaica is actually the legal, is the arm in the nursing fraternity that looks at the legal aspect of nursing for all nurses in Jamaica. Next slide. So the NPs are expected to possess advanced practice competencies and standards. And these standards should be reviewed regularly to ensure that the nurse practitioners reflect the ethical and legal principles of the profession of nursing. Next slide. So here in Jamaica, majority of the nurse practitioners are employed in the primary healthcare setting. There we have the University of the Hospital of the West Indies, where we have 2 nurse practitioners who are employed in the Accident and Emergency Department, which in your case, you'll refer to as the ER. But for the most part, all nurse practitioners are employed in the primary healthcare setting. Currently, nurse practitioners do not have prescriptive rights. So what normally happens here, all prescriptions written by the NPs requires the signature of the medical doctor. And that becomes a challenge sometimes because, for example, I'm assigned with another medical doctor to a rural health center. That medical doctor do not turn up for care. The patients are left without being seen, which somewhat is not a paradigm shift where we want to go in meeting universal health coverage. So several ministers of health had attempted to provide legislative autonomy to NPs, but this was without success. Next slide. So in 2021, a committee was set up by the Ministry of Health and Wellness. The aim really was to consider granting of prescriptive rights to nurse practitioners. The chair, interestingly, was a medical doctor. So the other members of the committees were the president of the NNA, the president of the Nurses Association of Jamaica, the chief nursing officer for Jamaica, an advanced practice nurse, which sadly was Heather McGrath, and the registrars for the pharmacy, nursing, and medical councils for Jamaica. Next slide. So here, the picture is not so clear, but it's showcasing the uniform for the nurse practitioners in Jamaica. So these nurses are actually employed with the Southern Regional Health Authority because we have 4 regional health authorities in Jamaica. We have the Western Regional Health Authority, the Southern, the Southeast, and the Northeast Regional Health Authority. Next slide, please. So 2 focus group discussions were convened with clients who the NP had served before and medical doctors who were employed in the primary healthcare setting. Interestingly, the clients reported that, in their opinion, the care offered by the nurse practitioners was superior compared with that of the medical doctors. And hence, there were three clients who participated in the focus group discussions, and 3 medical doctors, of which one of that medical doctor actually was a senior doctor, what we call a medical officer of health here in Jamaica. So following the discussion with regards to prescriptive right for nurse practitioners, a resolution was drafted by one of the medical doctors in support, of course, of granting prescriptive rights to the nurse practitioner. And she was influential enough to somewhat garner the signatures of over 70 medical doctors across the country. Next slide. Thus, in 2023, the Minister of Health and Wellness reported that the proposal for NPs to receive prescriptive rights was approved by the members of cabinet. Because here in Jamaica, we have certain processes whereby which we'll have to ensure that issues are dealt with. So this was, of course, so as committee members, we would have garnered a report which was submitted to the Minister of Health and Wellness. In turn, he will have to go to Parliament and somewhat give a synopsis of what we had somewhat drafted during the time that we met as committee members. And then the persons of the cabinet were given the privilege to peruse the document and to somewhat come up with a decision with regards to granting prescriptive right for nurse practitioners. So in that proposal, it's proposed that nurse practitioners who are employed in the public health system will be able to prescribe, but from a selected list of drugs. The Nurses and Midwives Act of 1964, I left that out, was amended to facilitate registration for nurse practitioner and nurse anesthetists as advanced practice nurses. Because what is happening here in Jamaica, we are not registered as advanced practice nurses, so we'll have to utilize our general nurse and our midwifery nurse licenses currently to practice as APNs. However, we have nurse practitioners and nurse anesthetists as advanced practice nurses here in Jamaica, but the prescriptive rights was garnered because we are somewhat proposing a renewed primary health care in Jamaica. So in light of that, we were somewhat focusing on the nurse practitioners in order to somewhat fill the gaps with regards to universal health coverage. Hence, the nurse practitioners were focused to receive prescriptive rights. Next slide. So in August 2024, the draft for the APN bill was completed. So in the Ministry of Health and Wellness, there's someone who has somewhat vast experience in policy, was tasked to somewhat complete the document. So several stakeholders were invited to a meeting, including myself. So we would have like the chief medical officer here in Jamaica, of course, the chair for the committee, someone from the pharmacy council. We would, of course, have the registrar from the nursing council, the chairman for the nursing council, and of course, the legal personnel from the Ministry of Health and Wellness. So currently, I know modifications are being convened to somewhat ensure that the document is finalized and submitted to the pharmacy council, for the parliamentary council here in Jamaica, for us to receive prescriptive rights for NPs in Jamaica. Next slide. I somewhat want to speak with regards to the specialization. So in Jamaica, actually, when we had the first cohort in 1977, we had family nurse practitioners, and as you can recall, and pediatric nurse practitioner. But the program for the pediatric nurse practitioner was somewhat short-lived. So hence, we presently only have the family nurse practitioner and the mental health psychiatric nurse practitioner, which that specialization came early in the 2000s. So here in Jamaica, the FNPs are responsible to provide care using their in-depth knowledge of the biopsychosocial aspects of health and disease. They also apply advanced principles of health management, health promotion and protection, disease and injuries prevention in the execution of their duties. Next slide. The FNPs are able to assess, after, of course, taking a complete history, diagnose, and manage clients with varying health issues across all the life cycles. There are the investigations such as blood tests, routine chemistry or complete blood count, thyroid function test, basic blood investigation, X-rays, which include a chest X-ray, X-ray of the spine or the extremities, ultrasounds of the neck, abdomen, and pelvis or lower limbs, and mammograms are routine screening tests that we order as well. ECG are what you will refer to as EKG, and perform minimally invasive procedures such as suturing or incision and drainage. Next slide, please. So I'll just show you a picturesque view of what our clinical setting looks like. So this was myself, Heather McGrath, at the Montego Bay Type 5 Health Center. It's actually the highest level of classification for health centers in Jamaica. We only have two, the Montego Bay Type 5 that is located in Montego Bay, and then the Comprehensive Health Center, which is located in the capital city of Kingston. Next slide. And showing another of my colleagues in the parish of Westmoreland, showcasing what a basic room looks like that we operate from here in Jamaica, in the western end of the country. Next slide. But the family nurses, however, though, are not allowed to order blood products, issue medical certificates beyond 7 days. So if the condition requires for us to issue up to 7 days, that's okay. But once it's beyond that, that should be out of our legal scope. And of course, the patients who, turn up at the health center or the health facilities with conditions which require legal intervention, then that's a no-no for the nurse practitioners. And of course, we do not prescribe cosmetic products. Next slide. So another aspect of our role as nurse practitioners is outreach intervention. So you're looking at nurse practitioners from the southern regions. 3 of them are in their uniform, the burgundy and gray. Others are in T-shirts depicting their region. So actually what they had been embarking for the last 3 years is a men's health day where everything is just focused on male. The male will come and get routine screens done. So just showcasing the other aspects of nurse practitioner role in ensuring that outreach interventions, because sometimes, some men, they don't have the time to come to the health center, and even if they come, they're always hurrying. So you'll have to go to them. So that's what these NPs in the southern region have been doing for the last 3 years. So kudos up to them. Next slide, please. Also showing the nurse practitioners at the outreach intervention during their mental health day. Next slide. So I'll switch over now to the mental health psychiatric nurse practitioners. And just like the FNPs, most of them are employed in the primary healthcare setting. But sadly though, here in the primary healthcare setting, I know from my region and my parish in more particular, there's no psychiatrist who are assigned. So it's kind of difficult. So the workload for these mental health psychiatric nurse practitioners is really vast. And they assess, diagnose, and manage clients with psychiatric and psychosocial issues. Next slide. And just showcasing, so for us, all nurse practitioners are asked to wear the same uniform. So if you look at the screen, you'll see different uniform. Why? Those persons in the brown, they're actually mental health officers. So before we had this psychiatric NP, these were the persons who were providing care in the community. So we still have them around. Some of these mental health officers have somewhat gone on to do the nurse practitioner course, but I was only able to get this picture, just give you a picturesque view of what the uniform looks like here in Jamaica. Next slide. Another specialization here in Jamaica is actually the nurse educators. So you have nurse practitioners who are employed at the University of the Hospitals School of Nursing. They teach either the undergraduate program or the postgraduate program. Most of them serve as investigators for students, while some also conduct or collaborate with other faculty members to conduct research at the university. Next slide. Another aspect of the nurse practitioner fraternity here are supervisory nurse practitioners. So as I mentioned before, we have 4 regional health authorities. So all regions should have a supervisory nurse practitioner. However, in one region, in the Northeast region, there is no supervisory nurse practitioner post that exists right now. We're continuing our quest to ensure that is filled, but presently we only have 3 supervisory nurse practitioners. So actually they serve as, you know, they're the ones who plan our monthly seminars, because as nurse practitioners, we have monthly seminars where we use those sessions to update our knowledge and skills with regards to our practice. Next slide. The professional organization. So most nurse practitioners here in Jamaica are members of the NNA, which is the Nurses Association of Jamaica. And as you can see, that is our lovely headquarters. In Kingston, we have 3 buildings, but this is our secretariat at Trevanion Road in Kingston. So they serve as somewhat a support to us with regards to advocacy for all nurses here in Jamaica. Next slide. And just showcasing, as a nurse practitioner, I guess I was take that bold step of, you know, as Jamaican encoder run for president. I'm actually one of the vice presidents for the Nurses Association of Jamaica. So it shows how vital and how versatile nurse practitioners are in filling different roles in nursing. Next slide. So at this point, I really want to highlight the Jamaica Association of Nurse Practitioners. So you have nurse practitioners who are members of the NAJ. However, since 2009, we have the Nurse JANP was formed. And I'm happy to share that this little JANP is an affiliate member of the American Association of Jamaica. So kudos to us for going ahead and trying to, you know, join with this august body of AANP in America. Next slide. This picture actually depicts in 2016, because then what had happened that a few years ago, some nurse practitioners thought that the NNAs were not, you know, meeting their needs. So it's out of that discussion we actually had the JANP came into being. So at that point, we had the National Workers Union, who was our bargaining unit. So this picture is depicting when we were signing the heads of agreement at the Ministry of Finance in 2016 for nurse practitioners. Next slide. And those are my little references for now. And thank you so much for listening. I avail myself for any questions that I can answer at this time. Thank you.